You are watching Chinese Medicine Safety, an online continuing education course by Waynesville Wellness. For other online and in-person courses, check out CEUSeminars.org. This course is on Chinese medicine safety. We're all required by the NCCOM to do some safety and ethics training, and I have some information I have found is not common practice for most Chinese medical practitioners. So that's what we're going to cover in this course. Safety often gets misconstrued, and people are only thinking about the safety of the patient. Safety, by definition, is a freedom from harm and danger, or a state of being safe. Always love it when the dictionary uses the word you're defining in the definition. It's also considered to be a place that's free from harm or danger. And for us, safety applies not just to the patient, but also to the practitioner. It's equally important for both to be safe in our practice. There are a few types of safety that we're going to cover, ranging from general safety to more specific kinds. General safety, we'll be talking about the building and the room and making sure everybody is safe in those general senses. We'll also be talking about needle-specific safety, right? The safety regarding the use of needles, both for our patients and for us. We'll be talking about extra modalities, cupping and gua sha, and the safety items we need to know for those. And we'll briefly be talking about herbal safety, what things we need to know to be safe while using Chinese herbs or any herbs. Safety for us includes things like universal precautions, both for interacting with our patients and for the sanitization of our tools and implements. Coming back to the topic of gloves, I personally, in my practice, wear gloves anytime I'm working with a patient for needling, cupping, gua sha, and most of the time when doing body work as well. For me, these situations are often semi-critical. Several of them we know are critical situations, and we'll come back to those definitions here shortly. The other reason that it comes in handy is dealing with needle sticks and infection risks from needle sticks. We're going to talk a little more specifically about needle sticks in a bit, but even though needle sticks are not prevented by wearing gloves, just know that gloves actually reduce the rate of transmission of infectious illness from a needle stick. Basically, the CDC looks at all possible situations when it comes to bloodborne illness and infectious illness as being in one of three categories. And they call those categories non-critical, semi-critical, and critical. In this hierarchy, non-critical essentially means that there is zero chance or likelihood that blood is present or body fluids are present in that situation, whether that be a surface or a patient interaction or a tool. They don't care. In all of those sort of situations, if there is no chance or likelihood that blood is present, that's non-critical. Your average interactions with your room, your doorknobs, the table, your desk, those sort of situations, surfaces at the counter in your break room, they're generally non-critical. And blood should not be present. Body fluid should not be present in those situations. So that's the non-critical category. At the other end of the spectrum are critical situations where we know blood is present, right? It's obvious. Surgery is a wonderful example of a critical situation. Blood is present. They have to cut you open. They know blood is present. That's a critical situation. In the middle is semi-critical. And it's really not a middle ground, because semi-critical means that there's some chance that blood is present. If there's a reasonable chance that blood is present, you have to treat it as if there's blood present. Right? When it comes to some of the modalities of Chinese medicine that aren't needling, like cupping and gua sha, many practitioners are fairly lax in their protocol. Cupping and gua sha represent, to me, a semi-critical situation. There is a growing body of evidence that shows that blood can be present, even on unbroken skin, with both cupping and gua sha. Any chance that blood is there on the surface after the technique means we should treat it as semi-critical. The clean needle folks are slowly starting to recommend a move in that direction, but the wheels turn slowly in any bureaucracy. For me, I want to be following best practice. When it comes to tools that are used on patients, the CDC has a little stricter standard than surfaces because tools are used repetitively on multiple people, and they need to be cleaned in between each use properly. The way that they do that high level of sanitization, because it's a semi-critical situation and it's a tool, means following very specific guidelines on acceptable ways to sanitize or clean those tools. We're going to walk through a few methods, or talk about a few methods, but I'm going to tell you the one that is the simplest in practice for practitioners today. So, what are approved methods? Something I don't have on the list, it was actually on the last slide, is autoclaving. Autoclaving is an approved method for cleaning your cups or sanitizing your cups. Remember that you can't sanitize a dirty cup. I know that sounds a little bit counterintuitive. Sanitization is cleaning. What I mean by that is you have to get the gross debris, right? The large globs of lotion and such off the cup. If you're sanitizing and there's lotiony stuff, goop on the inside of the cup or on the lip of the cup, all you can do is sanitize the outside film of that lotion, not what's underneath it. So to properly wash and clean your cups and sanitize your cups, you first have to remove gross debris, and that includes autoclaving. You have to wash them with soap and water first before putting them in the autoclave. The method that is most practical is a product called Sporox 2, which is a combination of hydrogen peroxide and a very small amount, I believe it's 0.85% phosphoric acid. Hydrogen peroxide breaks down into water and oxygen, so it's simple and safe to dispose of down the drain, and a legal, allowable thing to do. And phosphoric acid can be diluted with water, so as long as you run water down the drain with it, you're good. It will dilute and be harmless. We're going to come back to Sporox in just a minute. There are other things that are not compliant, and my favorites have to be Listerine, which I have actually been told people were taught in classes to soak their cups and spoons in. Listerine is a wonderful product. Listerine is great for gingivitis. Dr. Lister was a very smart man, but it's not a high-level sanitizer. It's not compliant, and if you use it and you're hauled into court, you have to try to explain why you used something that wasn't compliant. So don't do it. My other favorite is the Instapot, or pressure cookers that are commercially available. And while there is actually a decent amount of research happening to look at the effectiveness of an Instapot and other pressure cookers for sterilization or sanitization, the CDC has yet to list them as compliant. Maybe Instapot recognizes the market and makes a UL-listed, CDC-approved high-level sanitizing autoclave that's affordable. They're not there yet. And while there was a study recently done that tested the 5 most prevalent pressure cookers and found Instapot to be the most effective, it took 150 minutes for the Instapot to reach parity with other high-level sanitizers. 150 minutes is 2.5 hours. Even the biggest Instapot doesn't hold very many cups. You'd have to cook them in the Instapot for 2.5 hours. For what, 3 or 4 cups? every patient that you use cups on would need a 2.5 hour cooking time. It's just not practical, and it's not compliant.